Your Suncoast News. We're here for you.
A tool to help doctors more accurately diagnose Alzheimer's. The FDA has approved a radioactive dye that will assist doctors in determining if patients have the condition. And here to tell us more about it is Dr. Dean Sutherland. Dr. Sutherland, thanks for being with us this morning.
Good morning.
So this is pretty exciting for diagnosing Alzheimer's. Tell us a little bit about it.
You know, for 50 years or more, we've been saying the only way to diagnose Alzheimer's is to have an autopsy. Pretty extreme way to diagnose Alzheimer's disease. Well, even autopsy is only about 90% correct at diagnosing Alzheimer's. Well, now there's a new test. So Eli Lilly has made up a test that actually binds to amyloid plaques in the brain. So amyloid is a bad protein, builds up, and it causes destruction of the cells and the way the cells talk to each other. So this radioactive chemical binds to the amyloid, and you can see it on brain scans called a PET scan. So it actually raises the diagnosis to about 90% without having to have the autopsy phase.
And that's important.
Yeah.
And so I was reading that all Alzheimer's patients will have this plaque. So if you get this PET scan and this doesn't show up, then you don't have Alzheimer's,
Then
correct?
you probably don't have Alzheimer's. Then you need to look into other things like dementia or other causes such as normal pressure hydrocephalus. There's Lewy body dementia. There's a whole slew of these things, but also things that may even be very reversible, like B12 deficiency. You can have depression, and of course over-medication. You know, that's very common in the elderly population. We've seen plenty of patients who were on 20 medications that had fluid dementia and then went into the hospital. All the medications were stopped and got better.
Wow. Okay. And so I was also reading that sometimes when they do the autopsy, they thought the person had Alzheimer's and they didn't.
Very true. So the autopsy is not always right 100% of the time. You can have everything that goes along with Alzheimer's. You can have memory loss and the cognitive problems. The testing can all look the same, and you go have the autopsy and it doesn't show up. It's very frustrating sometimes. But so this protein is actually going to be very useful in the future. There's a problem with doctors reading it because some doctors are probably not going to know how to read it properly, but Eli Lilly is actually providing training for doctors, I think up to 6 hours at a time of training just for that one reason.
And is that the reason that this originally was not approved by the FDA? I think it was last year, is that right?
That's right. They were concerned that it was going to be overused and that people weren't going to read it properly, so you're still going to get the wrong diagnosis. I think they've cleared that up, so I'm really excited about this.
Yeah. Yes, I was going to say, so what do you think about for your patients or patients here on the Suncoast? This is promising?
I think it's very promising. You know, Alzheimer's is a big problem. By 2020 or so, it should double in terms of just this area, the number of people we have in this area. It's a huge problem. And if you're misdiagnosed, imagine if you're on the wrong medications, or if you're not put on medications that could potentially help you. And we do have some medications that can help people with Alzheimer's, so it's really important to get diagnosed earlier and earlier if possible.
And accurately.
Accurately.
All right. Well, thanks for being with us, Dr. Sutherland. Very important topic this morning. And now let's head over and take a look at our roadways.